Now we will be going through the dermatology questions asked in the recent FMGE examinations. So let's go straight away without wasting any further time. So the first question, a patient presented to the dermatology clinic reporting recurrent skin lesions as seen on the image, and the lesions appear after few hours each time he takes NSAIDs. So he is taking drugs, non-steroidal anti-inflammatory drugs, and every time after he takes the drugs he gets some lesions on the skin, and these are recurrent. So the best clinical diagnosis out of the choices mentioned are psoriasis, lichen planus, and urticaria, and fixed drug eruptions. FDE, fixed drug eruptions, are very common, and many patients are hypersensitive to many drugs and they develop rashes after the intake of the drug. So the history is suggestive. You have to go through the question properly, and it is a simple question just suggesting the fixed drug eruptions. Now, what is the most likely causative agent for a Tzanck smear showing multinucleated giant cells? So you have to remember that there is this patient who has got multinucleated giant cells on Tzanck smear. Now, basically, you are well aware of the viruses, and especially the herpes simplex virus, HSV, which is an important causative agent of herpes simplex labialis, herpes simplex in the oral cavity, around the mouth, herpes simplex lesions you see many times, commonly found and may be seen along with certain immunodeficient conditions like lymphomas and leukemias and patients taking immunosuppressant drugs. But pathologically, they are characterized by Tzanck smear showing multinucleated Tzanck cells. So you have to remember the herpes simplex virus, a very frequently asked question. Now, in addition, the third question is a clinical case scenario. A patient presents with fever. That's important after returning from a forest. So there is a tour to the forest. He returns and he has a black scar lesion seen on the back. And what is the drug of choice? Now, this is a very important question. Sometimes people go to trips along the forest, and especially outside, they have got this tick bite. And after the tick bite, they get a lesion which is in the form of a scar. And then this is basically an infection called as Lyme's disease, caused by a tick, Borrelia burgdorferi. And the drug given, choices mentioned, were penicillin, erythromycin, vancomycin, and doxycycline. Basically, doxycycline is a drug which is recommended for this particular disease, which is the Lyme's disease. So you have to remember the disease, the history, the causative organism, the drug responsible for causing, the drug responsible for treating this disease. Multiple drugs, but the drug of choice happens to be doxycycline. Now, a female presents with multiple simple umbilicated papules on the face, and the diagnosis is, see, there are these characteristic terms like scaly, like papular, polygonal, like this thing umbilicated. As you are well aware that there is this important disease which is important in case of immunodeficient children usually, but elderly can also get those lesions, especially on the face or anywhere. In case of immunosuppression, they can be widely spread on the body. And the important thing is umbilicated. Umbilication is an important feature of Molluscum contagiosum infections. And I will be coming ahead with, in the same few seconds after we just finish up this round, I will be showing at the end how these lesions look. So this is important, Molluscum contagiosum, and you have to remember classical umbilicated lesions. So this is something, a very important and a very, simple question which you cannot afford to get wrong. Another question, a patient with borderline tuberculosis leprosy represents which of the following finds and which is the nerve enlarged? Basically, tuberculosis leprosy is classically a hypersensitivity type 4 reaction, and basically what's important is that sometimes there can be these peripheral nerves which can be enlarged, especially a nerve behind the medial epicondyle of the humerus, and which is the ulnar nerve. In addition to ulnar nerve, there's a nerve which runs over here anatomically, greater auricular nerve. So greater auricular nerve and ulnar nerve can undergo hypertrophy, and they can be felt as thick cords. And normally nerves are not palpable, but this is a one classic condition, leprosy, in which greater auricular nerve and the ulnar nerve may get hypertrophied, and you can palpate these two nerves. Very important. So this is one of the questions which was asked. Another question which was asked: a child was bought with a gear of multiple lesions, and examination showed multiple vascular lesions on the palms and soles and oral mucosa. Which is the disease? Which is a disease? Basically, this disease is the foot, hand, and mouth disease, and it is caused by a virus, Coxsackie virus. This is very important. And hand, foot, mouth disease has been asked recently. Now, coming to the point that how and where from did we get these questions? Now, these questions were from basically the books NEET, PG, QR, and Platinum QBank. Now, this was the questions, and see how these questions were put in my books. This is a classical image of a patient having a herpetic lesion over here. So you can see, if I enlarge, these are the vesicles, the herpetic vesicles. And what is important, I have mentioned over here. So I have mentioned over here, you can see that this is the Tzanck smear, which was positive. I have mentioned in the class. So we have got, so which group of drugs was, so this is the case of herpes. You can just analyze the things in herpes and Tzanck smear of the cells. So very, very important. Tzanck smear is associated with herpes infection, and that's what was asked in the question. So this is a question from the book from the Platinum QBank image-based questions. Now, question number 50, which was there in my book, and I have mentioned tick bites are implicated in Lyme's disease. So it was already given. So a tick bite, forest, and Lyme's disease is caused by, as I mentioned, Borrelia burgdorferi, and it causes erythema chronica migrans. Now, the question which was asked, question number 41. So here is the question. So I have mentioned it compact, even the dosage of the drug. So Lyme's disease over here, it was mentioned in the question, which drug? So doxycycline is given. Give him doxycycline for 28 days. So I have mentioned in full detail. You can see Lyme's disease, tick bite, oral doxycycline is preferred. So it is not the amoxicillin, it is the oral doxycycline, a question directly from the NEET, PGQR, and FMGE. As I mentioned, hand, foot, and mouth disease. So I will just enlarge Coxsackie. Even the subtype A16 is the most common causative. And what are there? The cutaneous lesions on the hand, feet, palms, and soles, which was mentioned in the question. Mixed papules and clear vesicles with erythematous region. So that's important. So this is important, how you study what you study. Now, question number 44, fixed drug eruptions, a rash developing following administration of a drug, and they stop after the drug is stopped. So I have mentioned peculiar reactions on the same area of the skin each time the drug is administered. They may appear as macular, eczematous, any sort of dermatological presentation. So this is the crux, how we study these fixed drug eruptions, how we study hand, foot, mouth disease, how we study Lyme's disease, what are the drugs given for this disease, and these were the types of questions which were asked. So this is how we read, how we study. So two things I would mention over here. Platinum QBank. Maximum questions have been from the Platinum QBank and NEET PG quick review. Though it is NEET PG QR, but it is very, very helpful for FMGE students. The concepts remain the same, the standard remains the same, and it is basically the standard textbooks. You don't go by the social media. You don't read on social media, you don't read on Insta, you don't read on Twitter. You read from standard textbooks, and you read from very nice books around you without wasting time. And the questions which are asked are usually from the standard textbook. And these standard textbooks give you concept, and that concept helps you in any type of examination. So I wish you best of luck in your exams, and I hope your results are fine. And for the future students, I would strongly recommend Platinum QR, Platinum QBank, and NEET PG QR. Thanks a lot.